Hi, I'm Becky Larson, epidemiologist with Eagle County Public Health, giving a quick epi update on COVID here in Eagle County. So the first thing I'd like to mention on the dashboard is we will no longer be reporting the number of tests pending. Unfortunately, that data point hasn't been reliable. That isn't something that we have the ability to track internally, so we rely on our external partners to provide that information to us. So it hasn't been a reliable data point, so we'll no longer be tracking that on the dashboard. However, I do want to talk a little bit about testing and some of the impacts we're seeing across the country that impact us locally as well. So as we continue to see an increase in disease across the United States, with that comes an increase in demand for testing. And so all of those tests, or many of them, are being sent to the same commercial labs across the United States. And so the capacity of those labs are definitely taxed right now. And so that, for us locally, also impacts the turnaround time of test results. So right now, unfortunately, we're getting test results that are sent externally out in about 5 to 8 days. So a couple of things there. It's extremely important to remember, if you have symptoms, please stay home. Please isolate. If you choose to go get testing, know that even if those test results aren't back yet, you still need to isolate for 10 days from your symptom onset. So that's really important, even if you're starting to feel better, 10 days from the symptom onset. If you don't have symptoms, but you're a close contact to somebody that's a known case. So that close contact means that you're a household member or we're within 6 feet for 15 minutes or more. That also means that you need to quarantine, so you need to stay home for 14 days from your last date of exposure. If you seek testing, you still need to quarantine regardless of what those test results say. And that's because we know the incubation period, so the time from when you're exposed to when you could become infected, is 2 to 14 days. So even if you went after day 3 of your exposure from somebody and the test came back negative, that doesn't mean you're not going to become infected and have a positive test on day 14. So that's why that quarantine period stays the same regardless of if you get tested or not, if you're a close contact. If you are not a close contact to somebody, and don't have symptoms, you do not need to get tested. And please don't get tested. That puts a burden on our testing system. That's part of the lab capacity issue, but also in our supplies. So back in March, you might remember where we talked a lot about limitations of supplies. We're still seeing those limitations nationwide, which then impacts us locally as well. So the other thing I want to talk about is we are seeing an increase in disease spread here in our community. You can see that on the dashboard. We're kind of on week 2 of that increase, and we expect it to continue to increase even more in the next about 10 days. I don't want anyone to be surprised by that increase, but definitely we should be concerned, and there's a couple of reasons there. For one, we know this virus is going to continue to look for susceptible people, or virus fuel, as I sometimes call it. It will continue to look for them, and it'll continue to find them. So that's not going to change. What can change, though, is what we do to make it easier for the virus to find that fuel, to make it easier for it to spread. So if we want to kind of slow down that transmission, distance is the number one thing we can do. So that doesn't mean we can't hang out with our friends, but let's make sure that we're keeping that distance between each other, so that 6 feet while we're hanging out. That's important too if you're having kind of social gatherings, if you're at work. That distance is really key to preventing the spread of transmission. So the other thing we're seeing is we know that about 25% of our cases have an unknown contact, meaning we don't know quite where they were exposed. So that's why we have the distance, but also why we wear the masks. So when we're out in public, just remember those things are going to help our community decrease the level of disease, which then decreases the risk for everyone. The other thing I want people to know that as our disease levels increase, right now, yeah, most people are mild to moderate disease, but we can anticipate that will also increase the number of people that have severe illness and need hospitalizations or even death. So again, our goal is really to decrease the transmission and do everything we can to do that so that we can make it a healthier community for everyone, regardless of your age, regardless of your existing conditions. So that is our goal. And also know we're continuing to monitor the situation. So we're cautious, but I think we all know what we need to do. We need to just focus on that goal.